all wearing red today for National Wear Red for Women Day to draw attention to heart disease. Now, as we focus on heart health, we want to talk about the threat of stroke. Carotid artery disease is a major cause of stroke in the United States. We have Dr. Muhib Khan with us, a neurologist at Spectrum Health Medical Group, joining us to discuss the whole issue of stroke, because that's your specialty.
Hi, how are you?
Good, thanks for joining us today.
So patients, there's a lot of people who have stroke in U.S. All over the country. Stroke is the 5th leading cause of death in the United States at the moment. The best treatment, as I was talking to you earlier, of treatment of stroke is to prevent a stroke from happening. And in order to prevent a stroke from happening, you need to control your risk factors. And controlling the risk factors through medications and lifestyle changes has a major impact on your risk of stroke. And if people do that, then most likely you will not have a stroke in the near future.
Right. What happens during a stroke? What happens physically?
So most of the people do complain of weakness, numbness in one part of the body, loss of vision in one part of the body, facial droop on one side, loss of speech or slurred speech, severe headache. These are the most common symptoms. But the American Heart Association actually has come up with a nice acronym, which is called FAST, which is for facial, F is for facial droop, or any changes or asymmetry in face. A is for arm weakness or arm drift. And S is for speech, any loss of speech or slurred speech, and T is for time, which means that when you notice all these symptoms, you should be calling 911 because time is brain.
Yeah, and that's nice because when you think of FAST, you think of course, time critically important for people to get emergency assistance as quickly as possible. So what exactly happens in our body during a stroke? Is it the loss of blood flow?
Mm-hmm. So usually when you are having a stroke, a blood clot is blocking the flow of blood through a blood vessel. And beyond that blood clot, the brain in that part of that blood vessel is not getting enough blood, which causes some damage to the brain at that point. And if that clot persists for a longer period of time, the brain in that area dies out. Patients with carotid artery disease are at risk of stroke in multiple ways. One way is that because of the narrowing in the carotid artery from a cholesterol plaque, not enough blood is reaching the brain, and you could have a stroke because of that. Sometimes the plaque itself actually gets a little bit of piece of that plaque, which can go up into the brain and cause a stroke in a smaller blood vessels in the brain, and that can have devastating outcomes. Sometimes the plaque itself forms a little bit of a crater on top of the plaque, and then forms a clot on top of that crater, which blocks the blood vessel completely and causes a massive stroke as well. So these are the 3 ways people can have stroke due to the carotid artery, which can be quite devastating.
Are there things people can do to limit their potential for having a stroke?
So the most important thing which I mention to people is lifestyle. And when we talk about lifestyle, we talk about diet. So controlling your diet, trying to eat healthy with more fruits and vegetables, controlling your salt content in your food. And then the next thing about lifestyle is physical activity. So if you try to exercise 4 to 5 times a week, and moderate to intense activity can actually improve your risk of stroke significantly, and you will not have a stroke in the future.
You have a special program coming up where you're going to teach people all about this. It's called the Doctor Dialogue.
Yeah, we are going to talk about how to manage risk factors of having a stroke and to reduce your risk of stroke, and also to talk about carotid artery disease and how it can be, the risk from carotid artery disease and stroke can be reduced.
Yeah, that's coming up Wednesday, February 15th at Meyer Gardens. If you're interested, you definitely want to give a call and reserve your spot, and this is your contact information. You're part of the Spectrum Health Medical Group. Thank you so much, some important information.
Thank you.
We talk about keeping ourselves healthy.
Thank you very much.
And stay right there, more of 8-1. West when we come back.